And so the person was coming to them saying, I've completely lost my femininity. What man wants to be with me when I'm no longer the version of a female that I should be?
If you could teach the world one key insight about body image and sexual confidence, something that really moves the needle, what would it be?
Don't let social norms and physical limitations prevent you from creating new and exciting opportunities for yourself and for people to consistently and consensually and legally enjoy sexual desire and passion. So, a great example, and I talk about it in my book, The Wabi Sabi Body, is one of the things that I saw was recently I had a clinician come to me for a consultation because they wanted to know how to handle a client who had lost their sexual drive because they felt that they lost their femininity due to breast cancer, and so they
Hmm.
had to have a double mastectomy. And then the cancer had spread into the uterus, so they had uterine cancer, and so they were going to have a full hysterectomy. And so the person was coming to them saying, I've completely lost my femininity. What man wants to be with me when I'm no longer the version of a female that I should be? And I
Yeah.
talk about it from the illness trajectory and saying, hey, there's different phases that we go through sexually that really define not necessarily who we are as a male or a female, but define who we are as a sexual being. And really teaching people from that standpoint, and then teaching them how to overcome or how to adapt to the new them and the body that they're in, and accept the body that they're in, so that they have the ability to be able to embrace the newness
Yeah.
and explore new opportunities.
Yeah, absolutely. I love that example. Now, at Shaw, we train many people who are wanting to work in sexual health. What's the most important thing professionals need to know about working with people on sexual confidence?
The most important thing for people to understand in working with sexual confidence is really the concept that we have to, just like we engage people in an unbiased way therapeutically, we have to look at sexual confidence in a way that empowers them. And that's engaging people in a therapeutic way, in an unbiased way. We can't let our bias get in the way of whether or not we like ethical non monogamy, or whether we like solo play or particular toys or fantasies or fetishes or any of these other things. That we have to engage the person where they're at. And I think that that's one of the great things that Shaw teaches. Bias just doesn't apply to people's likes and dislikes, but bias even apply to their sexual desires and passions. And how do we empower them within those sexual passions and desires without allowing our sexual passions and desires get in the way and start influencing the way that they look at it. So as long as it's legal and it's consensual, embrace it and learn from them as much as they're learning from you.